Today, we have a very special guest with us. Dr. Yamauchi is a world-renowned dermatologist and the medical director of Dermatology Institute and Skincare Center. He is also the principal investigator of Clinical Science Institute. He is also involved as a clinical faculty at the David Geffen School of Medicine at UCLA. It is truly an honor to have him here with us today to talk about eczema.
Well, thank you so much, Daisha. It's my privilege and honor to do this interview.
So to start off, Dr. Yamauchi, how has our understanding of eczema changed within this last 10 to 15 years?
In the past 10 to 15 years, to treat eczema in terms of the pathogenesis, we've had a better understanding about the immunology of the disease, in that it's primarily a disease of a hyperactive immune system.
Mm-hmm.
So with eczema or atopic dermatitis, there's two kinds of conditions. One is called extrinsic atopic dermatitis and also intrinsic atopic dermatitis. The basic difference is that with extrinsic atopic dermatitis, it's more allergy driven.
Okay.
Some allergens in the environment trigger the onset of the atopic dermatitis.
So it's like contact then?
Sort of like contact dermatitis to a certain extent. And what it does is that it disrupts the skin barrier,
Okay.
thereby leading to higher levels of immunoglobulin E or IgE,
Okay.
as well as the upregulation of certain what's called Th2 cytokines called interleukin-4 and interleukin-13. And there's also intrinsic atopic dermatitis where there's no disruption of the skin barrier, and it's more what's called a Th1 mediated disease.
Okay. And so it is this disruption of the skin barrier that causes eczema, or are there other triggers that can cause eczema as well?
Usually it's the in the extrinsic form, there's some sort of allergen that triggers it,
Okay.
and which disrupts the skin barrier, causing what's called a flagrant, is a protein found in the epidermis.
Okay.
And that's defective, that leads to the onset of the eczema or
Okay.
atopic dermatitis. But then also other things that can trigger a flare-up are stress, your skin being too dry, for example, and also any kind of other allergic reactions as well.
Got it. And many people battle with eczema on a daily basis. And so what are some options that they have that can help them alleviate themselves from their eczema?
Sure. So to treat the eczema, what patients can do at home, if it's mild, the most important thing is to moisturize your skin all the time.
Okay.
Because if the skin gets too dry, then their eczema will get worse, as well as the itching is one of the more common symptoms found in eczema. So itching is something that really drives patients nuts.
Right.
And they're always scratching, and they get skin infections as well, the itching. So as long as they moisturize, that's very important. Also, if you take a long shower or bathe too long, actually excessive exposure to water will cause your skin to dry out. So if I tell patients to limit your bathing times to, let's say, less than 5 minutes a day, and to keep the water lukewarm, not too hot. And right after they shower, it's very important to moisturize to trap any kind of moisture that's present in the skin after you shower.
Okay. And when would you decide to prescribe oral immunosuppressants?
I would prescribe oral drugs, immunosuppressants, when the eczema is moderate to severe, or when topical therapy is not adequate. So usually a topical therapy, like a topical steroid, is the first line therapy to treat eczema. But then the patient is out of control, they're really flaring up, then might have to resort to something like prednisone or a systemic steroid to alleviate their symptoms.
Okay. And so these treatments that you just described, they're traditional treatments for eczema. So what are some new trends in new drug development for treating eczema?
So the new trends and the goal of these new drugs is to be steroid sparing, because as you know, with excessive steroid exposure, even topically, topical steroids excessive will cause your skin to thin out and cause stretch marks to appear as well. And with long-term steroids, you can get the typical side effects of osteoporosis, diabetes, a moon face. We want to prevent those from happening. there's also other traditional therapies like cyclosporin, methotrexate, which can be effective, but long-term therapy can result in liver damage and kidney damage. So what you want to do is a long-term therapy that's safe. So the pipeline drugs are biologic agents which are in development to inhibit the IL-4 and IL-13. And there are some in development which to date, some phase 2 studies have shown that these biologic agents are effective and quite safe to treat atopic dermatitis and eczema. There are also some pills being developed to treat eczema, which are probably safer to take long term, and also new topical therapy, which are steroid sparing, no steroids, which patients can use long term as well.
And so in the future, will steroids still be the first line of treatment? What would be the first line of treatment when?
Probably for the most part, yes. I believe that topical steroids will still be the first line of therapy because it's rapid acting in nature. It helps the itching, helps the redness, the scaling, etc. But then you cannot use that too long, and so we want to maybe switch them over to a non-steroidal cream, for example, to maintain the therapy. So what we do is that when a patient has a flare-up, then we use a topical steroid for a short period of time, and then transition over to a non-steroidal cream for maintenance of therapy.
And within these past 2 years, what are some names of some new drugs that have been approved for eczema?
Actually, in the past 2 years, there really hasn't been any new drugs approved, but in the future, one of the more exciting drugs as a biologic agent is called dupilumab, which is an antibody that targets IL-4 and IL-13, and the data so far looks like that in the phase 2 studies that over 80% of patients achieve at least a 50% reduction of their signs and symptoms of atopic dermatitis by week 12.
Okay. And so if patients now have tried all these different traditional treatments and if they have not been working for them, how can they participate in clinical trials?
So what they can do to participate in clinical trials is there's a website called www.clinicaltrial.org. And it's a website that lists all the various trials conducted across the country. So what you do is you type in your disease and then maybe the city where you live, and you could potentially find a clinical trial site.
Okay.
In addition, these sponsors that are in charge of the clinical trials also do a lot of advertising. So you might, on the radio or TV or newspaper ads, might find some sort of trial that's advertised.
Okay. And so once a drug reaches phase 3 in the clinical trials, how long does it usually take for it to reach market?
It takes about, unfortunately, 2 to 3 years. Because the phase 3 trials, even though the primary endpoint might be 12 weeks, for example, still they have to analyze the data, log the data, which might take a year after initiation of the phase 3 trial. Then it has to go to the FDA to get approved, which might take another year. So it might be 2 years from the time the phase 3 trial starts to final drug approval.
Okay. And so, for example, if someone's suffering from eczema, they see this advertisement from drug companies or they go on clinicaltrials.gov, which doctor should they contact in order to participate in these trials?
So what you go to the site that's advertising, but if also maybe your doctor, whoever doctor you see, like a dermatologist, they might be aware of another site that participates in clinical trials, and they can refer that patient over to us. So at our site where we do clinical trials, we've had other dermatologists refer their patients over to us for the more recalcitrant patients to participate in the clinical trial.
That's great. And what is your view on herbal and natural supplements to treat eczema?
In my opinion, these kinds of medications that are homeopathic are not really clinically tested, do not undergo trials, and so they haven't been proven, and sometimes people get actually a reaction to it.
Okay.
But a patient wants to do a homeopathic kind of approach, there's one ingredient, turmeric or curcumin, which is found in curry, and that has some anti-inflammatory properties. So sometimes it might help their inflammation. And also, I tell patients to reduce stress, to minimize the eczema, and also to moisturize as much as possible.
Right. And to end this interview, Dr. Yamauchi, I'd like to ask you what your vision for the treatment of skin conditions is in the future.
So the future looks very promising and bright in dermatology for the various kinds of rashes like psoriasis and eczema and other kinds of inflammatory rashes, where there's lots of new drugs in the pipeline in the forms of biologic agents, new pills, and new topicals. So there's a whole array of new drugs in the pipeline being tested, and I think that most of them will get FDA approved. However, unfortunately, with these new drugs, they're quite expensive, and so insurance companies are sort of hesitant in allowing them to be dispensed because of the high cost. But nonetheless, these are treatments that are very safe and effective, and certainly I would feel more comfortable prescribing these medications over the traditional medicines in the past.
Wow, that looks like a great future for all of us.
It's a great future, yes.
Thank you so much,
Oh,
Dr.
you're welcome.
Yamauchi.
Thank you so much, Jason. Anytime. My pleasure.